India, the land of infinity, with 1.3 billion people that speak over 1,600 languages and belong to 2,000 ethnic groups. India is the epitome of diversity.
The Indian story is not limited to the multitude of its cultures or the architectural genius of its monuments, but the contribution of each and every citizen in leading India towards growth and development.
Today, India is the world's fastest growing economy, leading innovation in agriculture, healthcare, and research.
Yet, not every Indian has felt the impact of this unprecedented growth. According to Oxfam, India ranks second worst globally in terms of equitable distribution of wealth.
Inequalities of massive proportions are not just depriving communities of resources and opportunities, but an entire nation from prospering.
Good morning, ladies and gentlemen. We are a team of 70 undergraduate students who believe that by empowering individuals as change agents, we can transform not just communities, but our entire nation. I am Anirudh Gupta.
Harsh Garg,
Nishtha Noonwal.
Vatsal Dhaka.
Raghav Mahajan with Nikhil Kapoor on technology. And we are Enactus Shahid Sukhdev College of Business Studies.
Today, we present to you our two flagship projects, Rahat, meaning relief, and Udan, meaning flight.
Can you imagine living without toilets? For 1,300 residents of Sultanpuri, this is an everyday reality.
with extremely high rates of diarrhea and worm infections, 1 in 10 families suffers the grief of burying their child before the age of 5. Even the children who survive are physically and cognitively stunted.
Women are robbed of dignity and face sexual harassment when they relieve themselves in the dark hours. This is the aftermath of open defecation.
Sultanpuri is not a remote village in India, but an urban slum in the national capital, New Delhi. With thousands of slum clusters like Sultanpuri, India faces a massive sanitation crisis.
But amidst this crisis, the plight of sanitation workers is often ignored.
Historically, certain communities in India were socially segregated and confined to the degrading work of manually removing human excreta from pit latrines. Considered as polluted and untouchables, these sanitation workers suffered silently. While this evil practice of manual scavenging has long since been legislatively abolished, even today, the stigma of sanitation continues and these workers are neglected. Vulnerable and marginalized, they continue to suffer.
To truly understand the problem at its core, our team studied the demand and supply factors of public sanitation in New Delhi. Through community surveys across slum clusters and engagements with municipal bodies, we learned that nearly 50% of toilet complexes in slums are unusable.
Despite investments by government towards construction of toilets, poor maintenance and vandalism render them defunct.
Given the filthy state and cultural misconceptions about toilets, people avoid their use and defecate in the open.
Sanitation workers work without equipment and receive very low wages. They face health problems and social exclusion, resulting in a low quality of life. Seeing opportunity amid systemic failures, we created Rahat. Rahat means relief. Our vision is to relieve the country of open defecation, the associated diseases, and the stigma around sanitation workers.
To set up the first chapter of Rahat, we signed an agreement with Delhi government's slum welfare body and undertook the management of a toilet complex in Sultanpuri.
We learned about the hardships of the local sanitation workers and resolved to improve their livelihoods.
Since prevailing models fail to provide adequate training and incentives to workers, leading to substandard maintenance, we developed an entrepreneurial model.
We identified two marginalized people for caretaking roles. Our extensive training program equipped them in plumbing and cleaning practices, interpersonal skills, bookkeeping, and provided them government mandated kits and equipment.
These entrepreneurs manage the complex, maintain cleanliness, and ensure safety of women and children. Users are charged a nominal fee as per government norms. Income generated is the entrepreneur's earnings after allowing for maintenance expenses and reinvestment reserves.
To encourage use of toilets, aesthetic modifications were made using concepts of color psychology. Our team developed popular movie and cartoon themes based on community likings. As a result, footfall in the complex increased, with many people using toilets for the first time.
Further, we enhanced our service design to suit different user needs, particularly women and children. Provisions were made for disposal of sanitary napkins and child friendly modifications such as low height wash basins.
Additionally, we introduced a system of monthly family passes at discounted rates while promoting family health through our sensitization camps.
Within a span of 6 months, the Rahat model produced tremendous results in Sultanpuri.
While only 52% of the target audience used the Rahat complex initially, aesthetic modifications increased the user base by a further 20%, followed by sensitization camps and service enhancements, which brought the remaining population on board. Today, all 250 families are proud users of the Rahat toilet complex.
As a result, rate of open defecation dropped from an alarming 95% to a mere 3%, a first-time achievement in any slum cluster of Delhi.
We strive to multiply the impact of Rahat and adopted 3 more toilet complexes.
But mobilizing large communities with differences in attitude and behavior posed an unprecedented challenge. As a solution, we customized our sensitization campaigns based on demographics.
For children, we used local games to educate them on proper use of toilets and hand washing habits. For women, our campaigns cover topics such as menstrual hygiene and precautions to exercise during pregnancies.
As a result of our sensitization efforts, people in slums now prioritize sanitation and say no to open defecation.
In just 1 year, by adopting a total of 4 toilet complexes, Rahat provides safe sanitation to more than 11,000 people.
$286,000 worth medical expenditure was avoided through our intervention.
We empowered 8 individuals who earn $660 per month. Regarded as sanitation leaders in their community, they now have a higher social standing and enjoy better living standards.
Let's hear from Pramod Kumar, our entrepreneur at Sultanpuri, how his life changed.
मुझे राहत शौचालय काम करने में बहुत अच्छा लग रहा है। बहुत उसकी सुविधा मिलता है। मेरे सेहत पर भी ध्यान रखते हैं लोग और मेरे परिवार पर भी सबको ध्यान रखते हैं। और मैं तो जी पढ़ा लिखा नहीं, मेरे माता पिता भी नहीं पढ़े हैं, लेकिन मेरे बच्चे स्कूल में जाते हैं और उम्मीद मैं करता हूँ जब से राहत मिले हैं इनकी वजह से मेरे बच्चे कॉलेज तक जाएंगे और राहत की वजह से मुझे लोग जानने पहचानने भी लगे हैं।
Rahat has been acclaimed as an exemplary model of public sanitation. With sanitation being a national priority, Rahat will now be replicated across slums in India as part of the Prime Minister's National Clean India Mission, which aims to eradicate open defecation. Our team would create a network of Rahat entrepreneurs across communities and train other maintenance firms to follow standards of operations.
By June 2017, our Rahat model would be implemented across 55 toilet complexes in Delhi, impacting over 148,000 people and empowering over 100 sanitation workers.
Sanitation is more about human dignity than disposal of waste. It is about a child not falling sick. It is about a woman not fearing for her safety. It is about a community living in harmony. This is what we aim to achieve through Rahat.
We now move on to our second project, Udan.
Last year, during one of our community outreach programs in the North Indian state of Haryana, we met a girl named Gudiya. Despite being in the formal education system for 5 years, she could not even spell her name or perform basic multiplication.
Taken aback, we examined children in her village Kaloi and found similar, persistent gaps in student learning levels.
For most families in rural Haryana, the hope of escaping poverty and hunger rests on the tender shoulders of their children. With such weak academic foundations, no matter how hard they try, they will always be shackled by a deficient education.
It wasn't just the students who were failing their exams, but the education system that was failing an entire generation.
According to National University for Education Planning, One in every 5 elementary school teachers in India does not have the requisite skills and qualification. The students and teachers lack resources and motivation to be effective.
How could we provide these students with vast learning materials to encourage self learning and bridge their academic gaps? The answer was clear: computers.
Kaloi, however, like most Indian villages, did not have access to computers. In fact, computer penetration in India is recorded at a meager 9%, nearly one third in comparison to the rest of the developing countries.
On the other hand, annually 500,000 working computers in India are discarded to landfills. This releases toxic chemicals which cause great damage to the environment and human health.
We realized that these computers do not belong in landfills, but possess immense educational potential which can be harnessed through reallocation and reuse.
Linking these two problems together, we established UDAN. UDAN means flight. A flight each child can take off towards their dreams with nothing holding them back.
To set up a computer lab in Kaloi, our team procured discarded computer devices from households and corporate offices.
For teaching children computer use and its various educational applications, we searched for individuals who could take up the responsibility of running the center.
Women in rural India are victims of deep-rooted gender discrimination. With marginal share in workforce, their potential is subdued and are confined to performing household duties.
Moreover, Kaloi is located in the state of Haryana with a sex ratio of 879 females per 1,000 males, the lowest in our country. We resolved to empower women by involving them as entrepreneurs for our lab.
We identified two spirited women who underwent computer training through our partners, Tally International and Literacy India. Our team imparted them skills of pedagogy and material management.
Since they lacked access to capital, we extended them microcredit, which covered their setup and initial operational cost. The amount would be recovered in 1 year, after which we would delink the business model.
At Udan Labs, students develop foundational skills such as reading and basic mathematics through computers using internet, text-to-speech, and open-source educational resources.
Further, the entrepreneurs ensure continuous learning by conducting regular tests and assessing performance.
In merely 5 months, overall academic performance for elementary level improved by 23%. The students were now eager to learn, which was marked by a 35% increase in their school attendance.
Gudia, who earlier could not even speak a sentence in English, now greeted us with a pleasant smile and said, "I love going to school."
But education was not a problem limited to Kaloi. According to the annual Status of Education report, 52% Indian students in grade 5 cannot read a second grade level textbook.
With 25% of India below the age of 14 years, this presents a grim scenario where India's massive human resource would never be able to achieve its potential.
Realizing the magnitude of the problem, our team worked together to turn our pilot in Kaloi into a nationwide solution for students and learners everywhere.
Working with district administrations, we selected 12 locations across 3 states to set up Udan Labs catering to 36 villages.
Our team conducted awareness drives in these areas for greater student enrollment and to familiarize villagers to the use of internet.
1,930 students have access to better education at a mere price of $4 per month.
For expansion, we partnered with Reboot India, a Microsoft accredited refurbisher, which provides us with quality assured refurbished computers in exchange of the e-waste routed by us.
Our innovative use of e-waste in these centers saved 700 tons of carbon footprint.
86,000 kilowatt hours of energy.
5,900 kgs of hazardous waste.
While students were marching on the path to a brighter future, the rest of the village remained in darkness with negligible access to information.
Hence, we upgraded Udan Labs to information centers approved by the government's Digital India program. 500,000 villagers will now have access to 135 e-services.
Villagers who were earlier disconnected from even government schemes now have bank accounts, avail pensions, and sell their farm produce at latest market prices.
3,050 young adults have enrolled for computer courses at our Udan labs, availing jobs worth $513,000.
Udan Labs now function as an elementary education center and an internet cafe, which form the revenue streams for the lab. Through our 12 centers, we created a total of 24 entrepreneurs, each earning $612 per month. This is about 40% more than the per capita income of India.
Udan Labs utilize discarded computers to provide low cost education by creating sustainable businesses for marginalized women. This threefold impact is the soul of Project Udan.
As we stand here representing Enactus as a CBS, we wish to highlight not just the quantitative impact or business strength of our projects, but also the magnitude of passion and commitment exhibited by the 5 people here and 30 behind you.
Across our projects, we have worked in diverse circumstances, addressing national priorities and creating extraordinary success with ordinary lives.
From prejudice to pride,
From waste to livelihood.
From segregation to sustenance.
But most importantly, from hopelessness to happiness.
This course of bringing a positive change has been a beautiful journey, a journey called Enactus.
Great job, team. Really, really good work. Just on the first project, Rahat, how do you select the 8 entrepreneurs, and how did you fund the facility, and how did you measure the reduction in open defecation from 95% to 3%?
Thank you for your question, sir. I'll be taking that. So, for answering the first part, how do we select these entrepreneurs? As we mentioned, these are local sanitation workers who are already working in the community. We learned about the hardships of their working conditions and decided to provide them with a better employment, that is managing the toilet complexes. Moving on to the, what was your second question, sir? Okay, sir, so these are public toilet complexes in India, and these are constructed by the government since these are public properties. Our role is to manage them, and we are in a partnership with the government. However, we assist them in selecting locations where these toilet complexes would be constructed, and our team undertakes service enhancements for women and children, as we mentioned. The third part which you mentioned, sir, how do we measure the reduction in open defecation? When we started out by conducting a pilot in Sultanpuri, we learned that it had a 95% rate of open defecation, which is a public statistic. Then, throughout the course of our project, we conducted need assessment and baseline assessment surveys with the communities, which helped us in tracking the levels of open defecation. Additionally, we have a pass system, the monthly pass system, which allows us to track how many families are using them at what intervals. So that also assists us, and we conducted a joint survey with the government to finally arrive at a figure of 3% open defecation.
And sir, to add to that, this 3% figure has been stabilized for the last 3 months.
On the same project, wonderful story. Can you walk me through like the relationship between the 8 entrepreneurs and I guess the remaining 900,000 sanitary workers? And like, for example, the women at the very beginning that were, I guess, cleaning up on the streets. What happened to them, and how does this project, how does it involve them?
Okay, so as we mentioned, sanitation has always been a stigma in our country. There was this evil practice of manual scavenging. However, that practice has been abolished, but the stigma continues and these workers are neglected. Through our project, we are trying to not rehabilitate them, but remove the stigma of sanitation. So while we are currently working with 8 entrepreneurs, we aim that through our intervention, there will be a community change, a change in the perspective of how sanitation workers are perceived everywhere.
So are those women now employed by these 8 entrepreneurs, or
Sorry?
are these women at the very beginning employed by the 8 entrepreneurs?
Yes, sir, we have women entrepreneurs as well.
To add to that, so we have local community teams, and we utilize these women to be part of the teams, and these also act as sanitation leaders in the community.
Um, Thank you. I would like to know how 4 toilet complexes were able to serve 11,000 people in the community. How many toilets do you have per complex?
Thank you, ma'am, for your question. We have around 35 to 40 toilet seats per toilet complex, and according to the government mandate, each toilet seat can cater to around 60 people. So that gives around more than 2,500 people can be sustained through one complex. But during the peak hours, it is obviously not possible to sustain such a large audience. But through our queue management and crowd management techniques, we have been able to increase the limit from 60 people to 80 people per toilet seat.
Okay, thank you.
Can you expand on the sustainability of these toilet complex in terms of the cost? Is it solely the government that is paying for the maintenance costs and this stuff, or is there some source of income?
Thank you for your question, ma'am. So, the government does not undertake the maintenance costs, it merely funds the construction of toilet complexes. Maintenance is outsourced to maintenance firms, and we have developed an entrepreneurial model which is serving as a business for the sanitation worker. So, he is essentially managing the entire complex on his own, and this is a high revenue generating business for him. So, that takes care of the maintenance expenses.
Just a question for your first project on the waste disposal. I just was wondering, after you guys, like the waste within the complex, like how is that disposed of?